best surgeon, and he charted his dream from LTMG College. And he then joined the General Surgery, Onco-Surgery at Tata and KEM Hospital. With a desire to be on par with the world's best, Dr. Desai completed the Fellowship of Advanced Cosmetic and Aesthetic Surgery at Singapore at Dr. Wolf's Wu. And Dr. Desai took up a fellowship in Cosmetic Surgery Department of Singapore General Hospital, where he worked with 9 cosmetic surgeons and gained from their vast experience. So the moment I saw him on stage, I just summarized what I had to, but it's a pleasure to have you with us. Welcome. And we look forward to your talk on Patients First in Healthcare, the challenge of creating a new and improved Medicare. Dr. Viral Desai.
Thank you so much for the introduction, for the kind introduction. I must thank the organizers for inviting me to talk here. The topic given to me was the challenges we face to improve healthcare, or putting patients first, and what are the various factors, what we can do about it, and what are the ecosystem factors as well as government-related factors. Now, of course, being a plastic surgeon performing only aesthetic surgery, my talk will be more based on patients who come in a cosmetic surgery clinic rather than general patients. Of course, my introduction, I'm a member of various societies. Now, one common thing which as doctors or as laymen we all learn is adopted from all Greek medical textbooks. The Hippocratic Oath contains the main things, and I hope I'm pronouncing it correctly. Primum non nocere. First, do not harm. This is the first principle taught to doctors, and this is the first principle taught to us in medical ethics. Do not harm. Help, but do not harm. Okay? And this we look at to create and overcome the challenges and delights of creating a world-class medical healthcare system. Now, the importance of aesthetic treatments. There was a survey done globally, and this is what patients had to say about it. Understanding a patient in mind. When a patient was asked a question, what is more valuable to you? Good looks, more money, or more friends? And of course, besides, many more factors were asked, and you won't believe good looks was as important as more money. And we would say money can buy everything, but that's not a fact. A lot of patients were asked whether you would let go of a treasured possession in order to have better looks, and 73% of the people said that they would let go of a treasured possession if they could in order to have better looks. Okay. The third question was, do you feel having good looks is important for getting a job or advancing in career? And nearly 2/3 of the patients believe that good looks are very, very important in order to progress in their career. Of course, are cosmetic surgery treatments acceptable to all today as compared to a few years or maybe even 10 years ago? And 91% of the people said that yes, cosmetic surgery treatments are far more acceptable today as compared to what they were before. Okay? The challenges we face, what we call as a steep, okay? The challenge we face is safety. Safety is of prime importance. Avoiding injuries from care, basically coming to the same fact, help but do not harm. Timeliness, you reduce the waits and delays for those who receive care. Effectiveness, the treatment which is provided should be based on scientific knowledge to all who could benefit and refrain, rather than providing service to those who will not benefit from them. Efficiency, this is mainly to avoid wastage, including wastage of equipment, supplies, ideas, as well as energy. Equity, provide care that does not vary in quality because of personal characteristics such as gender, ethnicity, socioeconomic status, and geographic locations. And of course, all treatment should be patient-centeredness. Provide care that is respectful of and responsive to individuals, patient preferences, needs, and values, ensuring that patient values guide all clinical decisions. Now, what I thought the 3 challenges in putting patients first are related to patients, related to the medical fraternity, and of course related to the ecosystem. Putting patients first. There are 3 things what I thought that patients were lacking. One was lack of knowledge, second was fear of surgery, and uncertainty of the outcome or uncertainty of the results. This can be overcome very simply by certain steps, by a detailed consulting. Lack of knowledge can be done by a detailed consulting. Never hurry up your consulting. By providing educative material and resources, pre-surgery counseling or pre-surgery sessions, and of course post-surgery counseling. The fear of surgery, which is one of the biggest fears all patients face, is do I need to undergo a surgery? Will it go correct? And what will be the outcome finally? So that again would be by patient counseling, a pro-con or a risk-benefit analysis, a statistical history providing how many patients have undergone certain surgeries and how many have benefited and how many have actually had any side effects due to this surgery. And of course, risk minimization tools. Uncertain outcomes. Uncertain outcomes is another big factor that can be overcome by pre-post pictures. Once patient would see pre-post results which is similar to them, they would be more sure of the outcome and they would be more confident of getting a surgery done. Past patient interaction or seminars, post-surgery care and pre-surgery analysis. Of course, the basic guideline always comes to two factors, the risk and the reward. Now, we all know that any cardiac surgery or any oncosurgery or neurosurgery would carry a lot of risk factors with it. But of course, the rewards there are greater. At the same time, in those surgeries which are essential, it may be so that the reward may not be that great, but otherwise, yet surgery is the only way out. In cosmetic surgery, or in all kind of aesthetic procedures, we try to see what is the risk-reward ratio. Simply put, if your risk is bigger than the reward to be achieved, the surgery should never be performed. Never ever do a surgery in such a case. But if your rewards far outweigh the risk that are associated with the surgery, then the risk factors have to be explained to the patient through proper counsel, and then the patient is a good candidate for such a surgery. So this is finally what evaluates the risk-reward ratio along with what patient expectations are. Now, I'd like to play a short video. Can we just start the video, if it's possible, of a patient who was not aware about what treatment to go for and how he went into a bad hands and then proper treatment.
Hi, my name is Gautam Khanna. I talk for a living. I have a radio and TV show. A couple of years back, I started losing hair. And obviously, I did lots and lots of things. I sat under a laser cap in advanced hair studio, and it didn't work. I went to VLCC, did hazard things on my head, which obviously didn't work. Then I went to Bangalore for a strip surgery, and which again didn't work. So I was completely frustrated, and a guy like me getting frustrated is very, very difficult. And I had tears in my eyes. I didn't know where to go. Then I had a lot of friends of mine from the television business. If I could take their names, like Gautam Khanna, who's a great stand-up comedian, and Rakesh Paul, who's a great television actor. I want to give both of you kisses because they referred me to a gentleman called Desai. Now, when they told me his name, I said, maybe again I'm going to be spending money, again I'm going to go there, again it's going to be a disaster of a result. And I was talking to them on the phone. So I called these two guys at a party and I said, listen, I want to see your end result. And honest to God, I'm an honest man. And yes, I saw the result and it was fabulous. So then my confidence went up to another level. Then I met Viral, who was this cool customer who was talking like James Bond, saying that, listen, just come to me, I'll sort it out. I said, hello, is he actually going to deliver results? Because I was bored from here. And being in the television business, comparing events, I needed the hair desperately. I needed hair more than my girlfriend, more than my wife. I needed hair. And then, obviously, seeing Gautam Khanna, Rakesh Paul, I said, I'm going to go for it. And you know what? It's not a testimony because 30 seconds back, I was actually having these two doctors along with Viral shoving a lot of things on my head. I'm zero in medical terminologies, but even 30 seconds later, I'm talking to you with a lot of energy, with a smile on my face, and trust me, I have not felt pain throughout this surgery at all. I've been talking to a lot of women who I'm trying to woo. I've been talking to my friends on the phone. I've been sending obnoxious BBM messages, watching MTV, VH1, and trust me, no pain. And my inner instincts tell me that this is going to be a sure shot, Sachin Tendulkar kind of a sixer, which means it's going to be a hit. And I promise you that. Couple of months down the line, I'm going to be with lots and lots of hair, and I have a strong feeling that people out there who are going to be watching this video, I might just end up donating hair to you guys.
Okay, of course, very close friend of mine now, Siddharth Kannan, he talks for a living, so a lot of things he said were a bit exaggerated. However, he did go into bad hands. He visited a lot of clinics. I don't want to take any names here. And he had very, very bad experiences with all of them. Finally, he came to us, and the entire process of surgery was so comfortable for him. While during the surgery, we shot the entire video, and post-surgery, he's become a brand ambassador. We can all Google him and see the results that we could achieve. Now, of course, Mahatma Gandhi ji's quote adopted here. The patient, if we all understand this as doctors and as consumers, we know what we're dealing with. A patient is the most important visitor to our clinic. He is not dependent on us. We are dependent on him. He is not an interruption to our work. He is the purpose of it. He is not an outsider in our business. He is but a part of it. We are not doing him a favor by serving him. He is doing us a favor by giving us an opportunity to do so. If we adopt this principle, and of course help but do not harm, I think we all would be good human beings rather than being and automatically transform into good doctors. Then the challenges faced in medical fraternity. I think a dear friend of mine, Dr. Khanna, had covered this regarding false advertisements and a lot of other things. I don't know where Dr. Khanna has disappeared suddenly, but I wish he was here to listen to this. The first thing, of course, practice by non-qualified doctors should never be encouraged. Surgeries performed by graduates, non-allopathic doctors should always be spoken about, the bad results, and they should not be encouraged. Cases of even dentists presenting themselves as plastic surgeons we have seen in our country. Practice by quacks who offer everything from liposuctions, facelifts to hair transplants. There is no restraint to rules of medical conduct. They are unmasked in news only in media, and only when a tragedy occurs they do surface up. Okay, what can we do about it? Monitoring by respective professional bodies is the need of the hour, of course. Educate and encourage patient to ask questions about the qualification of the doctor, about his experience, about what kind of a team does he have, what kind of a setup does he practice in, what are the safety measures that can be achieved there. Of course, practice by quacks is easier way to, what the government can help us is an easier way to initiate some legal action against them. The Ministry of Health can actively caution the society against false claims, as is being done by Ministry of Corporate Affairs. Ministry of Corporate Affairs does this very strongly, but the Ministry of Health, we believe, is not so active in cautioning the general public about such a thing. Also here we need to understand that we don't progress by putting our colleagues down. We progress together, and once we progress, then all the quacks are not there. I'm very unhappy. I'm actually sad to see that Dr. Khanna is not here to disappear at this crucial hour. But anyways, let's go further. Putting patients first, challenges in the ecosystem. Of course, he did speak about the service tax factor. Aesthetic surgery, aesthetic treatments are the only thing in medical field which are come under service tax, which is now 14.5% thanks to Swachh Bharat tax. This increases the cost of already expensive treatment, and I would say if a person has a crooked nose or a person who's got a disfigured face, would such a high service tax be valid in such a case? I don't think so. I think the government should sincerely look into this to abolish the service tax which is there in aesthetic treatments. And of course, medical insurance. In countries, in Canada, in UK, some of the some of the so-called aesthetic treatments like breast lift surgeries, some nose surgeries are covered in medical insurance because they are not considered purely aesthetic treatment. However, medical insurance does not cover any kind of treatment in India, and probably we need to look at these laws whether medical insurance should have a role to play in some of these surgeries. Of course, I would not say they should cover something like a Botox treatment or a hair transplant, but they do need to look into certain other treatments which can be disfiguring for the patient or deforming for them. Some thoughts. Talk to the patient first for the doctors. Of course, not putting down your colleagues, that's one thing. And talk to the patients first to understand his or her actual requirement. The patient entrusts themselves completely to their doctors. In our country, we are so-called considered in a way gods, okay? Patient come and say, what what God cannot do, doctor can do. It's wrong, it's completely false. Whenever a patient tells me that, I tell him I can only reach to the feet of God. I can never, otherwise I can never be there. I can only try and reach to his feet. But patients consider us and they put us up there. So this is our responsibility. It's our moral responsibility. Patient's care starts from the very first consultation, continues till the patient has recuperated till a normal lifestyle. Normally a surgery is done and doctors forget the patients. No, till the patient reaches his normal lifestyle, we must continue treating him. And of course, knowing when to say no to surgery